Hello, everyone. I'm Dr. Brockman. I'm the owner of this clinic, clinic director. I just want to do a quick video discussing some of the results that we've had with our neuropathy treatments. Okay, so maybe you've done a trial already, or you're someone that's looking into coming to our office, and you're thinking to yourself, is this real? Can this be real? So what I wanted to do is show you some genuine results that we are able to achieve in our clinic. So we're going to talk about neuropathy success examples. We're going to show you some before and after thermal pictures of people's feet that have experienced relief. And I'm going to go into a little bit of how we gauge success and how we measure success here in our office when it comes to our neuropathy treatment. So one of the tools that we use is thermal imaging. And this is a thermal picture of a patient that came into our office. And the nice thing about for this patient was they didn't have neuropathy. And so they had another cause of numbness and tingling in their feet that had nothing to do with neuropathy. And so one takeaway I want you to have is a lot of people come to us with numbness and tingling in their feet and they think that they have neuropathy. And after we put them through a very thorough exam, we determine that they actually don't have neuropathy. And we actually try to figure out what is causing the numbness and tingling in their feet. But we don't give you treatment for neuropathy unless you actually have neuropathy. So if you're standing in our front office and you're being offered a neuropathy treatment program, it's because you have neuropathy and we feel like we could fix it. If we don't feel like we could fix it, or if you have another cause of numbness and tingling in your feet that it does not involve neuropathy, then we figure it out for you and we present you with a different treatment plan that's not the neuropathy program. It could be chiropractic, it could be just shockwave by itself, or we could be sending you somewhere else that does not involve our office. One thing I want to point out in this picture, if this is a picture of a foot from the top, and you can see at the very bottom, okay, see where the red turns into green, and you can kind of see that's the big toe. That's somebody's really long toenail. And so you can see the toenails don't have a blood supply, and so they're going to be colder than nice, normal, healthy skin. But when you look at this person's skin here, when you look at the top of their foot, you can see it's a nice red color and it's a nice hot foot, which demonstrates the person has very good blood flow to their foot. Now, you can't diagnose blood flow from a thermal picture, okay? What you need is before and after pictures if you want to see what happened to their foot. But if the person does have good blood flow, generally speaking, they're going to have a nice red foot like this. We didn't make the diagnosis solely based on this picture. We put them through what's called the Toronto test, and that determines whether or not you have neuropathy. The thermal picture is what we call an outcome assessment tool. It's a way of for us to see a before and after picture of what's happening, but we can't make the diagnosis solely based on the thermal picture. So if we go to our next slide, okay, this is just a slide that talks about the Toronto test, okay? And so what we do is we look for symptoms like foot pain, numbness, tingling, weakness, an inability to walk or sense where your feet are. People with diabetes with neuropathy can walk, but they often need to look at their feet to walk because they can't feel where their feet are. And then upper limb symptoms is another key indicator. But the other thing we look for is whether or not you have reflexes and whether or not you can experience a pinprick sensation, so a pain, in other words, whether or not you can experience temperature on your feet, whether or not you can experience light touch on your feet, whether or not you can experience vibration on your feet. By the way, vibration is usually the first thing that you lose. And then whether or not you can determine the position of your great toe. Is it up? Is it down? And these are the things that are normally lost. So a lot of people have numbness and tingling in their feet, but they don't have a loss of these sensory modalities, and then they don't have neuropathy. There's a lot of other things besides neuropathy that can actually cause numbness and tingling in your feet. And we try to do a good job here at accurately diagnosing what your problem is so you don't get treatment that you don't need. I want to show you some example patients. This is an example patient, and we asked him to point to exactly where the numbness began. And I felt like this was a pretty interesting picture because he pointed right where the heat stopped. If you could see there on the left on that 7/29/25 picture, and that's exactly where the blood flow was inhibited, and it's where he started to exhibit a loss of sensory modalities. So he was a 75-year-old male diabetic. He was asked to point to the location where the leg numbness began. He was treated with shockwave only. So we have 3 different modalities that we use. One of them is shockwave. After 2 months of weekly treatment, he regained temperature sensation and light touch. Before and after thermal scanning demonstrated an increase in skin temperature due to an increase in blood flow to the legs. He was very happy with his result. And let me show you what his feet looked like. You could see over here on the left side of your screen that a lot of the heat was concentrated to his arch in the beginning. And look at his toes. His toes are blue and green. Those are really cold toes, okay? And then afterwards, you could see how the heat is dispersed throughout the entire bottom of his foot. And this also correlated with an increase in sensory modalities. He could feel light touch. He could feel temperature on the 9/23/25 pictures. Okay, if we go to his left foot, we saw very similar results. You can see that second toe on that left foot there, ice cold. You see how blue it is? Okay. Now you can see there's a little tiny spot of coldness on his left toe afterwards. So he still had a little bit of a problem with blood flow to the very tip of that toe. But generally speaking, we were able to see a nice disbursement of the heat throughout his foot, and this correlated nicely with an improvement in the Toronto test findings. Okay, here's patient B. Okay, so when we look at the Toronto test, you're given a score. So if you're in my office today and you're watching this and you've had your neuropathy screening, you probably were given a score by the physician that evaluated you. Now, this person, okay, you can see the foot on the left, they exhibited a 14 out of 19, so very severe neuropathy, okay? So they had a nice hot top of their foot, but you can see that second toe there has almost no blood supply or very little blood supply, okay? It's actually the same temperature as the background. The blood supply has been significantly inhibited, okay? And so they actually had an extensive treatment plan to get these kind of results, okay? We had to use all 3 modalities. We had to use the shockwave modality, the high-powered laser modality, and what's called the HITE, the high energy inductive therapy, to try to get the blood vessels and nerves working again in this person's foot. Okay, after 5 treatments, the score went from a 14 to an 11. Okay, and then we continued with the treatment, all 3 modalities. On the second re-exam, the score went to a 7 to a 19. Okay, and then finally, they came in for a 1-month follow-up, and the score was considered just barely neuropathy at a 6 out of 19. This person was able to regain several of the sensory modalities that are present when someone has neuropathy. And you could see the difference in the thermal scan. You can see the toe was basically the same temperature as the background initially, but following treatment, the patient was able to regain perfusion and blood flow into that toe. They're very happy. They can feel the ground when they walk. They don't have as much numbness and tingling. They were able to experience temperature sensation and light touch where they couldn't have done that before. And they were very happy with the treatment. So this is just want to show you, these are the types of results that we get in our office. Here's another patient, patient C. And the reason why I want to show this is another very good example of somebody that followed the treatment plan. Unfortunately for them, they needed all 3 modalities. And in the beginning, you could see in December 3rd, 25, they have very cold feet, okay? They were treated with shockwave, they were treated with height, they were treated with high-powered laser, and you can see a nice return of the heat into the toes. Nice disbursement of heat, not just concentrated in the arch, but now the blood is actually making its way into the feet, showing a clear improvement from the treatment that we're doing. Okay, so this is just basically a demonstration of our capabilities. These are case studies on patients that we've been able to perform this. If you have any questions, you can reach out to me. I'm the clinic director here, Dr. Brockman. You can talk to my staff, depending upon what your situation is. If you're watching this on Facebook or on Instagram, reach out to our office if you're interested in neuropathy treatment. Otherwise, we hope you have a great day, and thank you for watching.